about medical terminology. It is a little dry to some regard, but it's very important. Throughout the rest of your career from now on, you're going to have to talk in medical terminology. You're going to have to talk to coworkers, other doctors, nurses, other EMTs and paramedics in this kind of language in order for them to fully understand what you're talking about. So this is a very important chapter. I'll try to keep it from being quite so dry if I can. Uh-oh. It's working a second ago. Okay, let's try this again. Okay. So EMTs do need to have a working knowledge of medical terminology, like I talked about, just to be able to make language and giving reports to people a lot easier. It is important to understand key terms, acronyms, symbols, and abbreviations. We're going to talk about all of these items. You need to determine the meaning of an unknown word by understanding how terms are formed and learning the definitions for parts of a term. So when we make up a word, when we're talking in medical terminology and we're talking about a specific word, it's going to have a prefix, a word root, and a suffix. Those are the three parts. Not every word is going to have all three parts of that, but those are the options, and you put all those together and it forms a word. Understanding medical jargon leads to effective communication. It's like I talked about. When you are on a truck, if you're on a BLS truck, and you take a patient into Western Missouri here, and you need to report to the doctor or the nurse or another EMT or paramedic, in order to be able to effectively communicate with them what you're talking about, what part of the body you're talking about, where on the body it's located, in order for everybody to be on the same page, you need to know all of this terminology. It makes communication much easier. Medical terms are made of distinct parts that perform specific functions. Changing or deleting any part can change the function or meaning of a word. So there's some words that are very, very similar, and you change just one little tiny part of that word and it completely changes the meaning of that entire word. All right, so components that comprise medical terms include the word root, the prefix, suffix, and then sometimes a combining vowel. Those are the different options for making up words. Like I said, not every single word is going to have all of these parts of the word. How the parts of a term are considered determines its meaning. Accurate spelling is essential. If you're not a good speller, practice, learn. It's very important to be able to have accurate spelling. It kind of goes back to one of the very first week when we were talking about a lot of the legal aspects. As an EMT, later on if you go to paramedic or nursing or whatever you're wanting to do in the medical field, if you write a report and your spelling's terrible and that report gets sent to court for whatever reason, the lawyer is just going to shred your report, and it's basically going to have no meaning whatsoever because it doesn't look professional. It's not, there's a lot of mistakes. So spelling is very, very important. Knowing anatomy and the context of how words are used can help you correctly determine the term. So when Megan comes in an hour or so, you guys are going to start learning about A&P, anatomy and physiology, or the human body, and a lot of these words kind of go in with that, and you'll start learning about those things. All right, talking about the word root, it's the main part or stem of a word. So it is going to be the main kind of section of the word root. It conveys the essential meaning. So from that word root, you're going to have a really good idea of what you're talking about. It frequently indicates a body part, not always though, but a lot of times it does indicate what part of the body you're talking about. Add or change a prefix or suffix to change the meaning of the term. So like I said, the prefix is at the beginning of the word, suffix is at the end of the word. You can change those and still have the same word root, and it's going to completely change the meaning of the word. Usually, so talking about prefixes, it usually describes location or intensity. Not all medical terms have prefixes. Most do, but not all. And give the word root, it gives the word root its specific meaning. And we'll kind of get into some examples of different words and stuff here in a second. So talking about the suffix, it usually indicates a procedure, a condition, a specific disease, or a part of speech. And then talking about combining vowels. So it connects the word root to the suffix or other word root. Most cases it's an O. So like an example, cardio, that O at the end. Cardiology, I guess. Kind of the O in the middle there would be a combining vowel. But it may also be an I or an E. It's used when joining a suffix that begins with a consonant. So I can't even think of an example right now, but the suffix is at the end, right? It's the end part of that word. So if the first letter of the suffix is a consonant, a lot of times there'll be an O, I, or E at the beginning of the suffix just to kind of make it easier to flow into that word. It's obviously going to be very difficult if it starts with a consonant. All right, the prefix is at the beginning of the term, just like we've already kind of talked about. Suffix is always at the end. And then there it says the suffix begins with a consonant to ease pronunciation of the word. And then use a combining vowel when a term has more than one word root. So it is possible for some of these terms to have multiple word roots to kind of make up one bigger word. So a lot of times it'll have a combining vowel when there's more than one word root. All right, so apply these rules. So sometimes you add an S at the end of the word. For example, lung to lungs, easy enough, right? But then sometimes if there's an A at the end, so like vertebra, which is your spine, in order to make it plural, you're going to have to add an E at the end. So vertebrae. And then diagnosis, IS at the end, that's your suffix. And then to make it plural, you'd have to add, it'd be an ES instead of diagnoses. EX at the end for the suffix, like apex, which is basically an example of an apex is the tip of your heart. If you guys know kind of what your heart looks like, it's kind of got a little bit of a point down at the bottom, and that's actually called the apex. And then to make it plural, apices. And then on changes to ON or UM changes to A. So ganglion, ganglia, change or ovum to ova. And then US changes to an I. So bronchus to bronchi. So that's actually, bronchi is actually the plural form of bronchus. Prefixes can indicate numbers, colors, positions, and directions. Some prefixes indicate that a term involves a number or two or more parts or sides. So I'm going to try to give you some examples of these. So uni, UNI, means one. So hard to think of an example off the top of my head. I did write some down, so let me see if I wrote it.
Unilateral.
Yeah, there you go. Perfect. Unilateral. So unilateral means one side. So a lot of times when you're talking about, or when you're giving a report or writing a report, you'll talk about unilateral. So like I might write in my report, my patient was experiencing unilateral weakness, meaning that they had weakness on one side of their body. Obviously, we know what multi and bi means. Null means none. Diply means, or DIPL means two. Several word roots describe color. So all of these here describe color. So CYAN means blue. You're going to use that term pretty frequently as an EMT. The most commonly used word that you guys are probably going to use is cyanosis, which it means blue, like you might say cyanotic, the patient has cyanotic lips, so blue lips, patient has cyanotic nail beds, blue nail beds. Not a good sign when the patient has that, but that's what that means. LEUK is white, and a lot of times we hear leukocyte or leukemia. It's basically talking about the white blood cells. ERYTHR is red. So erythrocyte is basically another word for red blood cell. And then CIRRH is means orange, and the most commonly used word that we'll probably use for that is cirrhosis of the liver. It's just the coloring of the liver kind of turns. You'll see when people have cirrhosis of the liver, they turn kind of an orangey yellow color. They get jaundiced, right? And then NELAN means black. One of the most commonly used words for that is melena, and that's basically like a black tarry looking stool. That's what that means. Positions or directions. So prefixes can describe a position, direction, or location. So examples, ab, ad. I wrote these down because I can never remember these. So ab means away or separation. So away from the body, and then ad means coming in towards the body. So if you put those words at the beginning of a word root, you can kind of get different directional terms. CIRCUM means around, so like circumference. That's a commonly used one. Peri, PERI, about or around. And a lot of times you might notice too that there are some words that are different, but they mean the same things. So like circum and peri, they both kind of mean around. So some of these are interchangeable, and you can use them kind of in different ways like that. Epi is on, over, or near. So an example of that would be epicardium. So the epi, the prefix, would be for like around the cardium, around the heart. So epicardium is basically the lining around the heart. And then supra is above. All right, so some directional terms. So obviously right and left, right? When you're talking about a patient, when you're describing a patient, their symptoms or what's going on with them, or when you're writing your report, this should be self-explanatory, but it's always going to be your patient's right or left, not like if you're looking at them. So just be careful, because it is very easy sometimes when you're looking at a patient and then an hour or 2 hours later, you're going back and trying to remember, like trying to write your report. And in your head, you're like, okay, you're trying to picture the call. And sometimes it's easy to get those confused, right or left, if you're looking at the patient. So just always remember the patient's right or left. Superior and inferior. Superior is above, so like my head is superior to my chest. Inferior is below, so my chest is inferior to my head. Lateral and medial. Lateral is going to be on the outside. So my arms are lateral. My sternum is medial, so it's on the inside, kind of towards the midline of your body. Proximal and distal. These are the ones that are a lot of times a little more difficult to understand, a little more difficult for people to kind of grasp. So distal is away from a specific point of the body. So, for example, my fingers are distal from my elbow. Does that make sense? It's going away from the body, right? My fingers are distal to my elbow, whereas my elbow is proximal to my fingers because it's closer to the body. Does that make sense? Pretty easy, right? And then superficial and deep. Superficial is just kind of on the surface. You hear about, getting a superficial cut or something that's just kind of on the surface, not very deep. And then obviously deep would be more of a deep laceration. Ventral and dorsal. The way that I was taught to remember this, and actually really helps a lot, is I think of the dorsal of a dolphin. So their dorsal fin is on their back, right? So dorsal is basically on your back. So anywhere on your back, if you're talking about something, if you're talking about a cut on the back of your leg or something, you could say, the dorsal side of the leg. And then ventral is on the front side of your body. And then there's palmar and plantar. So palmar is here, plantar is on the bottom of your feet. And then like we talked about earlier, the apex, it's basically do you guys have what's the actual definition? It's like the tip of a location. So like your heart, you guys see your heart, it's the tip, the bottom portion of your heart. Same with the lungs. It's kind of the tip of the lungs. What does it say?
Is the tip of the surface.
Yeah. So usually that's pretty much the only time we really ever use the term apex is when we're describing or talking about lungs or the heart. I don't really use it any other time. We're going to go through these, I guess, again. So like I said, superior, inferior. Superior is nearer to the head, inferior nearer to the feet. So lateral, body parts that lie farther from the midline. And then medial is obviously closer to the midline. Proximal and distal describe the relationship of any two structures in an extremity. So proximal is closer to the trunk, closer to that midsection, and then distal farther from the trunk, near to the free end of the extremity. Superficial means closer to or on the skin, and deep means farther inside the body or tissue and away from the skin. So ventral refers to the belly side of the body. So here's another thing I didn't say earlier. So ventral and anterior are interchangeable. That you can use either of the terms. They mean the exact same thing. It's really honestly just a preference. If you're writing your report, it's just a preference. Would you prefer to say ventral or would you prefer to say anterior? I always use anterior and posterior when I'm talking or writing my report, but it is totally your choice. So anterior and ventral mean the exact same thing. Dorsal and posterior mean the exact same thing. And then there it says like the dorsal fin of a dolphin. That's just an easy way to remember it. So palmar, front region of the hand, the palm area, and then plantar is the bottom of the foot, and then the apex is the tip of a structure. So talking about actual movement terms, so flexion is the bending of a joint. So like when you bend your elbow, in, that would be flexion, and then when you bend it back out, that would be extension. Easy enough, right? We're extending our arm. Adduction and abduction, those are a little more difficult sometimes for people. Adduction with 2 D's is a motion towards the midline, so adduction would be going that way. And then abduction, moving away from the midline. So bilateral is both sides of midline, so both external and internal structures. So a lot of times I'll say my patient has, bilateral nystagmus, or they have bilateral breath sounds if I'm listening to lungs. You use that term quite frequently in EMS. Unilateral, like we talked about, one side of the body, so unilateral weakness, anything like that. So yeah, just so medical personnel will know where to look at and what to expect. All right, prone or supine. So who knows what supine is? You guys, have you learned that yet? Like, have you heard it? So I know some of you have been on clinicals. So yeah, supine is flat on your back, right? Completely flat and on your back. Prone is going to be flat on your face, on your stomach. So those terms are used a lot. Fowler's position, so semi-reclining with the head elevated. So we call it semi-Fowler's, and that's typically the position that almost all of your patients go on the cot. So when you move a patient from their recliner and you put them on your cot, typically you're going to probably put them in a semi-Fowler's position. Basically, that means their feet are extended out in front of them, their head's elevated about 45 degrees or so. You can also use the term high Fowler's position, and that's just basically when they're sat straight up. I use that position a lot for respiratory patients. If it's more difficult for them to lay back further because it makes their breathing worse, I'll sit them straight up into a high Fowler's position. So yeah, semi-Fowler's patient sits at a 45-degree angle, high Fowler's patient sits at a 90-degree angle. Alright, about that. So now we're going to get into some actual words. So the word nephropathy. So if you take, so at the very top, obviously you've got NEPHR. That's the word root. And then O is the combining vowel, and then PATHY is the suffix. So the whole word together means disease of the kidney. Kidney disease. So pathy means disease, O is the combining form, NEPHR is the word for kidney. So nephritis, nephropathy, nephrology, all of these are words talking about the kidney. Nephrology is basically the study of the kidneys. Nephritis is a kidney infection. So if you start putting words together, things will start making a lot more sense. Dysuria, the IA means condition of. DYS means difficult, painful, or abnormal. UR is the word for urine. So you put it all together and you get painful urination. Is it making sense how you guys put these words together? Once you've done a few words, it's pretty easy after that. And a lot of it is just experience. The more you hear these words, the easier it'll get to understand them. Hyperemesis. So hyper means excessive or a lot of. Emesis is the word we use for vomiting. You'll need to definitely remember that one. We use that one a lot. So you put the word hyperemesis, put it all together, it's excessive vomiting. Analgesic. IC is the suffix meaning pertaining to. AN is the prefix meaning without or absence of. And then ALGES is the word root meaning pain. So pertaining to no pain, analgesic. So a lot of times we give analgesics in the field. It's basically what we call pain medication to try to help with their pain. Shorthand used for communication, developed for speed. So do not trade speed for accuracy. So I've read reports in the past where every single word is an abbreviation or something, and you can't even read the report because it just makes no sense whatsoever. So just make sure that, yes, you want to use medical terminology to make things a little bit more clear and understanding, but just be careful with going overboard. You want to only use commonly understood acronyms and abbreviations to minimize errors and to maximize understanding of whatever you're talking about. Here at JCAD, we do have a list of approved abbreviations. We're only supposed to use those abbreviations when we're writing our reports. If you get hired on somewhere, more than likely they're going to have their own set. Most places are very, very similar. You might have some different abbreviations that are allowed by that service, but just make sure that you know your service is allowed abbreviations. So yeah, use only accepted abbreviations to avoid confusions and errors. Be familiar with abbreviations in your service area. And then when it comes to symbols, you want to only use accepted symbols to avoid confusion and errors. Ooh, that was a quick lecture. Alright, so which of the following components of a medical term conveys its essential meaning? Word root. We all agree? Word root? Perfect. Prefixes can indicate what? Color, conditions, body parts, or procedures. You think color? Perfect. The plural form of the word bronchus is what? Bronchi, right? The statement, the lungs are superior to the bladder, indicates that the lungs are closer to the what? We all agree? See? Good job. Movement of the arm towards midline is referred to as? Towards midline. Which one? A body part that lies closer to the midline when compared to another is considered to be closer to the midline. Okay. Blank is used to identify a body part that is on the belly side or the anterior surface of the body. What was it? B or D? D. Okay. I thought I heard some B's in there. Yeah, ventral. You place a patient in the semi-palace position for transport. This means the patient is?
C.
Good. C, sitting at a 45-degree angle. A laceration located on the plantar surface is on the sole of the foot. When using abbreviations, acronyms, or symbols, an EMT should I think delta, all of them? No, it's all. Yeah, only use those that are medically accepted. Don't be making up your own abbreviations. All right, any questions? I know that's kind of a boring chapter and quick chapter, but like I said, the more that you guys experience, like actually get out there on the trucks and actually start writing your own reports and start listening to the medic give their report at the hospital, you'll learn these words will start making a lot more sense. And as we go through, like I said, Megan's going to come in here and talk about the human body. She's probably going to be talking about some of these terms as well.